Hello friends and welcome to my channel. In this video we'll be learning about the anatomy of the urinary bladder. To begin with, in this diagram we can see the sagittal cross section of a female pelvic cavity. Anteriorly we can see the bladder, the vaginal canal, and posteriorly the rectum. So here we are going to learn about the urinary bladder. The urinary bladder is a muscular reservoir of urine which lies in the anterior part of our pelvic cavity. Now there are detrusor muscles of the urinary bladder that are arranged in holes and spirals, and it is adapted for mass contraction rather than for peristalsis. In this diagram we can see the detrusor muscles of the urinary bladder more clearly. They are adapted mainly for mass contraction rather than peristalsis. Now we all know what is peristalsis. It is a uniform contraction and relaxation of muscles that occurs mainly in our intestines as well as the esophagus. But here in the bladder we can see a mass contraction that takes place. Next, let's look at the size, shape and position of the urinary bladder. Now the bladder varies in its size, shape and position according to the amount of urine that it contains. Now here you can see the X-ray of the pelvic cavity of the empty bladder as well as a full bladder. When empty, the urinary bladder entirely lies within the pelvis, but as it fills, it expands and extends up to the abdominal cavity, reaching up to the umbilicus or even higher. Concising the important points that we learned till now, the urinary bladder is a muscular reservoir of urine. It lies in the anterior part of the pelvic cavity. The detrusor muscle of the urinary bladder is arranged in holes and spirals, adapted for mass contraction rather than peristalsis. Looking at the size, shape and position, the bladder varies in size, shape and position according to the amount of urine it contains. When empty, it lies entirely within the pelvis. As it fills, it expands and extends upwards into the abdominal cavity, reaching up to the umbilicus. Now let's look at the external features of the urinary bladder. An empty bladder is tetrahedral in shape, and it has an apex that you see right here, a base or a fundus that is directed backwards, neck which is the most fixed and lowest part of the bladder, three surfaces, that is the superior surface, the right surface and the left infralateral surface, and four borders, that is two lateral, that is one right here and here, one anterior border and a posterior border right here. A full bladder is ovoid in shape and it has an apex that is directed upwards towards the umbilicus. It has a neck that is directed downwards and two surfaces, that is anterior and posterior surface. Concising the important points and the external features of the urinary bladder, the empty bladder is tetrahedral in shape and has an apex which is directed forwards, a base or the fundus which is directed backwards, a neck which is the lowest and most fixed part of the bladder, three surfaces, that is superior, right and left infralateral, four borders, two lateral, one anterior and one posterior border. Now a full bladder is ovoid in shape and it has an apex which is directed upwards and towards the umbilicus, a neck which is directed downwards and two surfaces, that is the anterior and posterior surface. Now let's learn about the relations of the urinary bladder. Firstly, we'll look at the relations of the apex. The apex is connected to the umbilicus by the medial umbilical ligament that you see right here. Next, we'll be looking at the relations of the base. Now, this diagram shows the sagittal cross section of the female pelvic cavity. Here you can see the urinary bladder. Here is the uterus, the cervix and the vagina, and here is the rectum. So, looking at the relations of the base of the urinary bladder, in the female, it is related to the uterine cervix and to the vagina that you see right here. Now, in this diagram, you can see a sagittal cross section of the male pelvic cavity. Here is a urinary bladder and here is the rectum. Now, in the male, the upper part of the base of the urinary bladder is separated from the rectum by the rectovesical pouch that you see right here and the contained coils of the intestine. And the lower part is related to the seminal vesicles that you see right here and the terminations of the vas deferens. Now the triangular area between the two deferent ducts is separated from the rectum by the rectovesical fascia of Denon Willems that you see right here. This is the fascia. Next, let's look at the relations of the neck of the urinary bladder. The neck is the lowest and most fixed part of the bladder. It lies 3 to 4 centimeters behind the lower part of the pubic symphysis. Now in males, smooth muscle bundles surround the bladder neck and the preprostatic urethra. In females, the neck is related to the pelvic fascia, which surrounds the upper part of the urethra. Now looking at the relations of the superior surface of the urinary bladder, in males it is completely covered by peritoneum and it is in contact with the sigmoid colon and coils of the terminal ileum. In females, it is greatly covered by peritoneum except for a small area near the posterior border, which is related to the supravaginal part of the uterine cervix. Moving on to the relations of the infralateral surface that you see here and on the opposite side, they are devoid of peritoneum and they are separated from each other anteriorly by the anterior border that you see right here, and from the superior surface by the lateral borders right here and here. In this diagram, you can see the medial view of the lower part of the pelvic wall and the pelvic diaphragm. Now the urinary bladder is superimposed right here in order to show the relations of its infralateral surface. So let's look at the relations. Now in the male, the infralateral surface that you see right here is related to the pubis, the puboprostatic ligaments right here, the retropubic fat shown in yellow, the levator ani muscle that you see right here, as well as the obturator internus muscle right here. In females, the relations of the infralateral surface of the urinary bladder are the same, except that the puboprostatic ligaments are replaced by pubovesical ligaments. Concising the important points and the relations of the urinary bladder, the apex is connected to the umbilicus by the median umbilical ligament. Looking at the relations of the base, in female it is related to the uterine cervix and vagina. In male, the upper part of the base is separated from the rectum by the rectovesical pouch and contains coils of the intestine. The lower part is related to the seminal vesicles and the terminations of the vas deferens. Now the triangular area between the two deferent ducts is separated from the rectum by the rectovesical fascia of Denon Willems. Looking at the relations of the neck, it is the lowest and most fixed part of the bladder. It lies 3 to 4 centimeters behind the lower part of the pubic symphysis. In males, the smooth muscle bundles surround the bladder neck and preprostatic urethra. In females, the neck is related to the pelvic fascia, which surrounds the upper part of the urethra. Looking at the relations of the superior and infralateral surface, in males it is completely covered by peritoneum and is in contact with the sigmoid colon and coils of the terminal ileum. In females, the peritoneum covers the greater part of the superior surface except for a small area near the posterior border, which is related to the supravaginal part of the uterine cervix. Looking at the relations of the infralateral surface, these are devoid of peritoneum and are separated from each other anteriorly by the anterior border and from the superior surface by the lateral borders. In males, each surface is related to the pubis, the puboprostatic ligament, the retropubic fat, levator ani muscle, and the obturator internus. In females, the relations are the same, except that the puboprostatic ligaments are replaced by the pubovesical ligaments. Now let's learn about the ligaments of the urinary bladder. We have true ligaments and false ligaments. In this diagram, you can see the rectum and here is the urinary bladder, and these green color structures are the ligaments. Now looking at the true ligaments, these are condensations of the pelvic fascia around the neck and the base of the urinary bladder. Looking at the first ligament, we have the lateral true ligament. The lateral true ligament of the bladder that you see right here extends from the side of the bladder to the tendinous arch of the pelvic fascia right here. Second is the lateral puboprostatic ligaments right here, which is directed medially and backwards. Then comes the medial puboprostatic ligaments that you see right here. It is directed downwards and backwards. Now looking at the true ligaments of the urinary bladder in females, the bands similar to the puboprostatic ligaments are known as the pubovesical ligaments that you see right here. They end around the neck of the bladder. Next we have the medial umbilical ligament and the posterior ligament that you see right here. The posterior ligament of the bladder is directed backwards and upwards along the vesical plexus of veins that you see right here. It extends on each side from the base of the bladder to the wall of the pelvis. Concising the important points that we learned under the ligaments of the bladder, we have true ligaments, that is the lateral true ligament that extends from the side of the bladder to the tendinous arch of the pelvic fascia. We have the lateral puboprostatic ligament that is directed medially and backwards. It extends from the anterior end of the tendinous arch of the pelvic fascia to the upper part of the prostatic sheath. Looking at the medial puboprostatic ligament, it is directed downwards and backwards. It extends from the back of the pubic bone to the prostatic sheath. In females, the bands similar to the puboprostatic ligaments are known as the pubovesical ligaments. They end around the neck of the bladder. The median umbilical ligament is the remnant of the urachus, and the posterior ligament of the bladder is directed backwards and upwards along the vesical plexus of veins. Looking at the false ligaments, we have the medial umbilical fold, the medial umbilical fold, lateral false ligament, and the posterior false ligament. Now let's learn about the interior of the urinary bladder. In an empty bladder, we can see that the greater part of the mucosa that you see right here shows irregular folds due to its loose attachment to its muscular coat. Now in a small triangular area that you see right here, over the lower part of the base of the urinary bladder, the mucosa is smooth due to its firm attachment to its muscular coat. Now this triangular area is called the trigone of the urinary bladder. The apex of the trigone is directed downwards and forwards, as you can see right here. The internal urethral orifice opening into the urethra is located at the apex of this trigone. The ureters open at the posterolateral angles of the trigone, as you can see right here. Their openings are 2.5 cm apart in the empty bladder and 5 cm apart in a distended bladder. Now there is a slight elevation on the trigone immediately posterior to the urethral orifice produced by the median lobe of the prostate, which is called the uvula vesicae, that you can see right here. The base of the trigone is formed by the interurethric ridge or bar of Mercier that you see right here. It is produced by the continuation of the inner longitudinal muscle coats of the two ureters. Concising the important points in the interior of the bladder, in an empty bladder, the greater part of the mucosa shows irregular folds due to its loose attachment to the muscular coat. In a small triangular area over the lower part of the base of the bladder, the mucosa is smooth, and this area is called the trigone of the bladder. The apex of the trigone is directed downwards and forwards. The internal urethral orifice opening into the urethra is located here. There is a slight elevation on the trigone posterior to the urethral orifice produced by the median lobe of the prostate, and this slight elevation is called the uvula vesicae. The base of the trigone is made of the interurethric ridge or the bar of Mercier. Now looking at the capacity of the bladder, the mean capacity of the bladder in an adult male is 220 milliliters. It varies from 120 to 320 milliliters. Now filling beyond 220 milliliters causes a desire to micturate, and the bladder is usually emptied when it is filled to about 250 milliliters to 300 milliliters. Concising the important points under the capacity of the bladder, in an adult male, the capacity of the bladder is 220 ml. It may vary from 120 to 320 milliliters. Filling beyond 220 milliliters causes a desire to micturate. Filling up to 500 milliliters may be tolerated, but beyond it may be painful. There can be referred pain in the anterior abdominal wall as well as the perineum. Looking at the arterial supply of the urinary bladder, the main supply comes from the superior and inferior vesical arteries, the branches of the anterior trunk of the internal iliac artery. An additional supply can be from the obturator arteries as well as the inferior gluteal arteries. Looking at the venous drainage and lymphatic drainage, lying on the infralateral surfaces of the bladder, there is a vesical venous plexus. Veins from this plexus pass backwards into the posterior ligaments of the bladder and drain into the internal iliac veins. Looking at the lymphatic drainage, most lymphatics from the urinary bladder terminate in external iliac lymph nodes. Finally, looking at the nerve supply of the urinary bladder, we have parasympathetic fibers from S2 to S4 segments of the spinal cord. They are motor to the detrusor muscle. Second, we have the sympathetic fibers from T11 to L2 segments of the spinal cord. They are inhibitory to the detrusor and motor to the preprostatic sphincter mechanism. Then we have the somatic pudendal nerve that supplies the sphincter urethrae, which is voluntary and situated within the walls of the urethra, as you can see right here. Finally, we have the sensory nerves that carries pain sensations caused by distension or spasm of the bladder wall. Concising the important points under the nerve supply, it is supplied by the vesical plexus of nerves. The parasympathetic efferent fibers are motor to the detrusor muscle. Sympathetic efferent fibers are inhibitory to the detrusor and motor to the pre-prostatic sphincter mechanism. The somatic pudendal nerve supplies the sphincter urethrae, which is voluntary, and the sensory nerves carry pain sensations that are carried by parasympathetic nerves and partly by the sympathetic nerves. To get the notes of urinary bladder as well as other notes of anatomy, physiology and other health science subjects, visit my website, the link to which is given in the description below. To get updates on my latest videos, click on the subscribe button. To get notifications, tap on the bell icon. Thank you for watching.